Psychiatric problems in childhood are often difficult enough, but a new study says even if you grow out of them, adulthood may still be tougher than for others. A new study in the Psychiatry Journal of the American Medical Association says people who had common psychiatric problems in childhood are 6 times more likely to have higher rates of health, legal, financial, and social problems as adults. For more on this study, I'm joined by CBC medical contributor Dr. Danielle Martin. So what do you read out of this?
Well, we've always known that having mental health problems in childhood and adolescence put people at risk later in life. In fact, 70% of mental health disorders declare themselves before the end of adolescence. But what this study adds to our understanding is that even if people don't actually develop what we would think of as a true psychiatric disorder in adulthood, the fact that they had troubles in childhood puts them at higher risk for what we would think of as life problems, troubles with the law, financial difficulties, difficulties finishing school. And I think that that's an important contribution to our understanding.
The report also talks about subthreshold symptoms. What's that?
So this is interesting. What the authors found is that children who experienced what we would think of as adjustment kinds of difficulties, who had some symptoms perhaps of anxiety or depression, but not so significant that they would actually qualify for a mental health diagnosis, even those kids who were subthreshold continue to have a significantly increased risk of problems later on in life. And so I think...
Yeah, what does this mean? What needs to be done?
Well, what it means, I think, for all of us is that we need to understand that when kids are having a difficult spot, often that's related to stuff going on in the family, in the school, in their general environment, having the supports in place to help that person through and to identify and deal with issues early on is critically important, and we shouldn't be waiting until kids actually meet the criteria for a psychiatric diagnosis to put those supports in place for them and for their families.
Thanks so much.
Thank you.
Danielle Martin.